Hello and welcome again to the class. It is Poultry Science. Thank you so much for staying tuned. Thank you for liking. Thank you for subscribing. Thank you for sharing. And if you've not done that, please do subscribe, share, like, and thumbs up. Now, I like to continue on our series on health of birds, the poultry birds. So today we have a new topic: infectious bronchitis, also called in the short form IB. Infectious bronchitis is a respiratory disease. The bronchi, of course, when you hear the bronchi, it's a part of the inner structure of the lungs. So that gives you a clue that it is a respiratory disease. And it is severe. It can be severe that you begin to see signs, we'll get to the signs and symptoms of bronchitis in the bird. Now, it's also called bronchitis. Now, what are some of those signs that will tell on the severity of the ailment? Now, first of all, it is a viral ailment. Most ailments that are caused by virus can be managed. Some of them may not be cured, but they can be managed. In order to prevent them, you have to vaccinate against them. Now, vaccination, we've treated on this during the first earlier videos, so you want to go to previous videos and then we spoke lengthily different videos on vaccination. Now, what are those factors that determine the severity of infectious bronchitis? Number one, you have the immune status of the animal. If the birds are healthy, they will not fall so severely to the ailment. But if they are already having signs recovering from one ailment to the other, and this strikes, it's going to be deadly. Number two, the environment of the bird. If the bird's environment is such that there is no cross ventilation, no ventilation, or a place that is endemic to viral diseases, or even this, the animals are going to come down with this disease, and it's going to be severe. Number three, the age of the birds. Younger birds fall prey to it easily rather than compared to older ones. And now quickly we go to the signs and symptoms. Signs and symptoms refers to the things you see, and then you begin to have some reason to think that this could be this and this. And then when you begin to see certain signs, you begin to tell, is it a respiratory disease or digestive disease or this and this and that. Now let's go straight to the point. Generally, most ailments causes the animal to lose appetite. The same thing applies to humans. Loss of appetite, that is also said to reduction in feed intake and water intake. How do you know? You see an animal, you give them a certain quantity, maybe in grams or kg, you give them feed and then you go. And suddenly one day you come, you discover that the feed that they always consume, at this day they did not consume it. You try again the next day, you discover that no, that means there's an ailment. You act fast. So let's go. Now we see first is loss of appetite, and several things are attached to this. In which case, once the animals lose appetite, they become weak, they become unthrifty, they become also, if they were laid eggs, they won't lay. But let's go take one by one. Another thing you see to give you an inkling that it's infectious respiratory disease is the signs of coughing. You see coughing, you see sneezing, and you also see gasping. Gasping for air, trying to get some air, coughing. Now, another one is a whistling sound. You see with humans that are asthmatic, you see the whistling sound. It's like breathing in, it's like whistling in the lungs. The whistling sound from the lungs and from the nose, especially at night. Now, you see the chapping sound, like pew, 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 pew. Just like that at night or at all times. So you begin to hear those kind of sounds in the flock, maybe with one use. Look carefully to observe the one that is having that sound, and then remove that to treat before it spreads. And then I also want to recommend you treat all if it happens to be. Then you see lesion. Lesion means injury in the lungs and tracheal congestion. You don't see this one outside. They said you take one of the birds and then you do a postmortem. After you check the lungs, you see injuries or lesion on the mucosa, the external part of it, the linings of the lungs. You begin to tell that this animal is one of the signs that will be leading towards this. Number 6, you see watery discharge from the eyes while the animal is still alive. You see watery discharge from the eyes and from the nose. The same nose is congested also, and then it's not able to breathe properly. Now you see difficulty breathing, the nose is watery, and then the eyes watery. It's whistling from the nose and the lungs and chapping sounds you hear. You also see urates in the kidney. The kidney ultrafiltration is not properly done. You see the conversion of feed and water. So the final product should be uric acid, but this time you see it stop at urates. It's a problem. That is after you can get this when you take sample of these two or the dropping and then you run a test. You see it there. Then number 9, if this is a laying bird, the last 3 for laying birds, you see a sharp decline in egg production. They are not feeding well, so they won't produce well. They are not strong, they are not active. They won't produce egg. Then, if they ever produce egg, or if they produce egg, the eggs will have different kind of deformities. We'll come to egg deformities in one of the days. We'll come to it. You see shell-less eggs. You may see egg being too small. You may see the albumin being watery and different deformities in the egg. Then you may also see a situation where even the fertile egg may not hatch. These are some of the signs and symptoms that you will notice in infectious bronchial disease. Infectious bronchitis. We'll get to infectious bronchial disease one of the videos after this. If you have a question or anything you don't understand, please let me know. But meanwhile, for the length of the video, we'll stop here. I want to thank you for understanding. Thank you for staying tuned. Please let's see the next video. In the next video, I'm going to be talking about, we'll talk about the signs and symptoms and the introduction is a viral disease. We're going to go in the next video to be looking at the treatment and also prevention. We're also going to be looking at the mode of transmission. How is the virus transmitted from one bird to another? Please stay tuned in the next class. Thank you so much. See you next.